Not even that. Mic's open now.
Yeah.
You need me to verify that you're getting audio?
Well, I'm getting audio, but they were saying it's kind of, they were picking up some other kind of chatter.
Well, I had all my mics down, so you just asked, so it's nothing on my end. Do you have your camera mic up? You shouldn't be hearing anything now. Oh, wait a sec. Let me see.
There's a mic fly somewhere.
Oh, you're right. There is.
Good afternoon, everyone. I have some updates today with respect to COVID and also some comments on the federal election. But first, I'd like to point out that today I appointed Jason Kenney as Minister of Health and Tyler Shandro as Minister of Labour and Immigration. I want to thank Tyler for his service to Albertans over the last 2 incredibly challenging years. When I asked Tyler to serve as Health Minister in April of 2019, nobody could have predicted the crisis that he would be tasked with taking on. But as elected leaders, we don't get to choose what challenges will come our way. We can only do our best to work hard to address them. Tyler's dedication to the job and to serving the people of Alberta has never been in question. He's one of the hardest working people I've ever known, and he has brought his heart to his job. For example, by working hard to expand insurance coverage for very expensive medications for rare childhood diseases. However, as this crisis evolves, so too must our response to it. And so I have accepted Minister Shandro's resignation as Minister of Health. It is time for a fresh start and a new set of eyes on the largest department in the government, especially at a time such as this. Minister Copping has proven himself as a thoughtful and capable leader in government who is ready to take on the daunting task of overcoming this fourth wave and preparing the healthcare system to deal with whatever the virus throws at us in the future. Minister Shandro will continue to serve at the Cabinet table as Minister of Labour and Immigration. He will lead the implementation of the Alberta Advantage Immigration Strategy and the Fairness for Newcomers Action Plan, while working with other ministers to advance our Skills for Jobs agenda to address the emerging labour shortages in many parts of Alberta's economy. Turning now to COVID-19 and our efforts to overcome the fourth wave. Last week, I told Albertans that we had no choice but to make necessary and critical steps to prevent our health system from being overwhelmed and, once again, to slow the spread of COVID-19 in Alberta. As I said last week, we must urgently do three things. First, increase hospital capacity, particularly in intensive care units. Secondly, increase the number of vaccinations in Alberta. And thirdly, reduce viral transmission. That is why we declared a state of public health emergency with limits on private gatherings, entertainment facilities, retails, and other activities. But it also included the introduction of the new restriction exemption program, or the proof of vaccination program, which I believe is off to a strong start. I'm pleased to report that in the 72 hours after we announced this program, more than 78,000 doses of COVID-19 vaccine were administered. And the momentum continues, with more than 23,000 doses administered yesterday. As of today, 81.4% of eligible Albertans have now gotten at least one shot, and 72.8% have gotten 2 shots, both sharp increases from just over a week ago. In fact, since we launched the $100 incentive for people to get vaccinated about 3 weeks ago, we've seen over 120,000 people step up for their first shot, which has increased that share of the population by about 3 percentage points. Very important protection for those people, their loved ones, and our whole healthcare system. I'm also pleased to say that over 2 million Albertans have gotten their proof of vaccination cards since Sunday. And I'd like to pause to thank the tens of thousands of businesses and different organizations who are working hard right now this week to comply with the restriction exemption program. Earlier today, I held a number of meetings with, for example, the Chambers of Commerce, the Association of Petroleum Producers, and other business organizations, partly to address the implementation of the program, to thank them for their cooperation, and also to encourage them to in turn encourage their employees to get the protection of vaccination. As well, I am pleased to report that the reproductive rate of COVID in both the Calgary and Edmonton health zones dipped below 1 last week. This is small, but still important progress, and it reminds us all that we can get through this if we do the right things. But I must be clear, we still have a long way to go. We know it'll take time for the health measures that we put in place last week to bend down the curve and stop the spike of hospitalizations that could threaten our health system. Alberta Health Services continues to do all that it can to increase capacity in our health system, particularly in intensive care units where pressure is most acute. Currently, we have 337 beds available in Alberta ICUs, including 164 surge spaces that have been created. AHS has opened 37 additional surge spaces in the past week. There are currently 293 patients in ICU. I should say that, fortunately, over the past week, we've actually seen a slight decline in the number of COVID ICU patients, but unfortunately, a significant increase in non-COVID ICU patients, particularly this weekend. There appears to have been a number of admissions related to drug overdoses, a reminder that COVID is not the only public health crisis that we are facing in Alberta. Nevertheless, with 293 ICU patients, the vast majority of whom are COVID positive, some 90% of whom are not vaccinated, this is a very serious pressure on the system. Provincially, ICU capacity, including these additional surge beds, is currently at 87%. Without the additional surge spaces, provincial ICU capacity would be 169% based on our normal baseline. That is why Alberta Health Services has already reached out to other provinces for help with staffing and to explore, if necessary, potentially transferring patients to provinces with spare capacity, just as we in the past have accepted patients from other provinces when we had spare capacity and they were in need. And over the past several days, I've spoken to almost all of the premiers across the country, partly to compare notes. We're all facing similar, in many cases, very similar challenges. We're all facing capacity challenges in the healthcare system, and I want to thank all of them for their solidarity and cooperation. It is also why earlier today we initiated planning with federal agencies for potential additional support, again, to plan responsibly for a worst-case scenario. Our planning includes a potential aeromedical evacuation capability from the Canadian Armed Forces, including getting more personnel skilled in patient management and transfers that can help support relocating patients to hospitals outside of the province if needed. Let me be clear, we do not currently need this support, and we do not have an imminent need of it, but it's prudent to plan for things in case we reach a worst-case scenario. Today, I'm also announcing that, effective immediately, Alberta will be expanding the groups of severely immunocompromised Albertans who are eligible for a third dose of vaccine. Dr. Hinshaw will give you details in a moment, but this move brings Alberta in line with National Advisory Committee on Immunization recommendations and protects those who are uniquely vulnerable due to advanced HIV infections and other conditions. Third doses of COVID-19 vaccines are also available for seniors living in congregate care, and I urge everyone in these settings to get their third dose. And on Friday of this week, the Alberta Advisory Committee on Immunization will be meeting, in part to review whether we should expand access to booster shots to other vulnerable populations. Finally, before I invite Dr. Hinshaw to speak, I would like to congratulate Prime Minister Trudeau on the re-election of his minority government last night. I'd also like to congratulate all members elected to the House of Commons and to thank the hundreds of candidates from all parties and the tens of thousands of election volunteers for their commitment to Canada's democratic process. We will get down to work with the Government of Canada and all parties in this minority parliament on issues that matter to Albertans, which first and foremost means getting through this fourth wave of COVID. And one key lesson of the COVID era is that we must expand the capacity of Canada's healthcare system. That's why Alberta's government has joined all of the provinces in calling for a significant increase in the Canada Health Transfer to reflect these pressures and rising healthcare costs. I look forward to discussing this urgent priority with my fellow premiers later this week at a virtual meeting of the Council of the Federation. Alberta's government will also continue to fight to secure a fair deal in Confederation, beginning with much-needed reform to the federal equalization and fiscal stabilization programs. Economic recovery coming out of this period must include all regions and all industries and all workers. And that means as well Alberta's energy sector, the largest sector of Canada's economy. And with that, I will now invite Dr. Hinshaw to say a few, actually Minister Copping, who is his first appearance as Minister of Health, will now say a few words.
Thank you, Premier. Good afternoon, everyone. I am profoundly honored to be asked to serve as the Minister of Health during this pivotal time for Albertans. And I want all Albertans to know that I am deeply committed to helping steer the province through this current crisis and on to better days. I'd also like to thank Minister Tyler Shandro, my colleague, for his dedication to the health and well-being of Albertans through these unprecedented times. We obviously have immediate and significant pressures on our healthcare system right now, and I step into this role resolutely committed to building immediate capacity. However, we also know that COVID-19 is not likely to go anywhere anytime soon. But today I would like a commitment to look forward. I'll be working on 3 key issues to shift how we manage COVID-19. First, increasing our baseline hospital capacity permanently. Second, educating vaccine-hesitant Albertans to get more Albertans immunized. And third, preparing our health system to more adequately respond to potential future waves of COVID-19. I know there are many questions of how, and there will be details to come on that. But for now, I will be stepping into this vital role and executing on these priorities. The pandemic has changed our world. It's touched the lives of every individual, family, and community. It's not what anyone would have wished for our future, but it is our reality. We must adapt and change to live with COVID-19. We have learned much in the past 18 months. We have much more to learn. Now, I'd like to start with one of the items on my priority list right now and ask anyone who has not been vaccinated to talk about it with a health professional. Many people have questions, and that's okay. It's good to question. Just be sure to place your trust in the experts for your answers. Alberta Health has a resource information available at alberta.ca/COVID-19. I encourage you to seek answers here and discuss any issues with your doctor. In closing, I want to urge all Albertans to stay strong and stay united. I know this has been an incredibly tough journey, and it's been much longer than any of us wanted it to be. Please be kind to yourself and be kind to each other. Listen to one another. And remember that Alberta is a strong province. Albertans are a tough people. We will persevere, and we will get through this together. I'd like to thank again the Premier for putting his trust and faith in me, and I look forward to serving all Albertans as a Minister of Health. Thank you, and I'd like to turn it over to Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. Before I get to today's update, I'd like to address some confusion around the public health measures for youth sport and recreation activities. We know that physical activity is critically important for the overall health and well-being of youth and necessary to daily living, which is why youth sport and recreation activities are out of scope for the restrictions exemption program. Some facilities that serve both adults and youth are requiring proof of vaccination for those under 18. Operators do have the ability to set rules that exceed the minimum requirements in the CMOH orders, and I support providing everyone aged 12 and older with the protection that vaccine offers. At the same time, I encourage facility operators to consider what opportunities you have to allow all youth under 18 to use your facilities whenever possible, with other COVID precautions in place. I would also like to remind everyone that masking in all indoor public spaces is mandatory in all parts of the province, even in those businesses that have implemented the REP. This is a critical time for our province's healthcare system. Wearing a mask is a small but important step that will help protect you and everyone around you. As I said last week, each health measure is another layer that, when combined, work together to help reduce transmission and protect the health system that is facing severe challenges right now. Please get vaccinated. This is a critical layer of protection, and please continue to follow the health measures in place so we can drive cases down and stop the spike in hospitalizations. Turning to today's numbers. Over the last 24 hours, we have identified about 1,500 cases of COVID-19 and completed about 13,600 tests. Our positivity rate currently stands at 11.1%. We have identified 2,011 additional cases of variants of concern in the last 24 hours. There are now 996 people in hospital being treated for COVID-19, including 222 in the ICU. Sadly, I must announce that 29 new deaths were reported to Alberta Health in the last 24 hours. Some of these individuals were double vaccinated and had pre-existing health conditions that compromised their immune systems, but most were not vaccinated at all. These numbers could have been very different, and that makes these losses even harder for those who are left behind. Our actions every day are literally a matter of life and death and should be treated as such. Staying home when sick, following public health rules, and getting immunized are life-saving actions, full stop. My deepest sympathies go out today to everyone who's grieving a loss from any cause, whether COVID-19 or anything else. Today, I would like to announce a small expansion of who can get a third dose of vaccine and answer a recurring question that we've heard from parents whose children, like mine, are under 12. It's amazing to think that we've had vaccines available in Alberta for less than a year. We are closely watching emerging evidence on how vaccines and new variants interact over time, and we continue to refine our approach based on the best currently available information. Recently, the National Advisory Committee on Immunization recommended that individuals with moderate to severely immunocompromising conditions should receive additional doses of COVID-19 vaccine. This is based on research that shows these individuals aren't protected as well as others with the normal 2 doses of vaccine, but can improve their protection with a third dose. Here in Alberta, we are already offering additional doses of vaccine to immunosuppressed Albertans, including transplant recipients, those currently receiving active cancer treatment, those with chronic kidney disease undergoing regular dialysis, and those taking certain medications for autoimmune diseases. The NACI recommendations include a few health conditions that were not previously covered in Alberta, so we are adjusting our program to align with the national recommendations. This means that anyone with the following conditions is now also eligible to receive a third dose. Individuals undergoing CAR-T therapy, those using high-dose steroids and other immunosuppressant drugs, those with stage 3 or advanced HIV infection, and individuals with genetic immunodeficiency syndromes. We are now including these individuals because their conditions make it harder for them to develop and sustain the same levels of long-lasting immunity. These booster doses will help to better protect them, especially with our current high case rates. Having said that, even after a third dose, some people remain vulnerable because of their medical conditions. To protect them, all of us can do our part by getting both doses of vaccine. To be clear, right now, individuals who have these health conditions and seniors in congregate care facilities are the only groups to whom we are offering third doses or booster shots for clinical reasons. If you are not in these groups, please know that we are continuing to follow the research and emerging evidence. I know some countries have moved to recommend additional doses for other groups, and it's important to remember that each country has a different context when it comes to the types of vaccines used, intervals between first and second doses, and other factors unique to those settings. As always, we will adapt as new evidence emerges, and we are watching the evidence on booster doses very closely. On a related note, I know that many parents with young children are eagerly wondering when vaccines will be available. Right now, there are no vaccines approved by Health Canada for use in those between the ages of 5 and 12. There are no vaccines for under 5 as well. However, as we speak, global studies are underway looking into whether we can offer vaccines to those under 12 as well. Our goal is to provide protection to as many Albertans as possible as safely as possible. We will not offer vaccines to younger people until the studies on vaccines and younger age groups are completed and evaluated. At the same time, we have a system in place to move quickly to offer vaccine to additional age groups if vaccine is approved by Health Canada and recommended by the National Advisory Committee. Until that day comes, we all need to remember that younger children rely on us to protect them. Together, we are building a protective shield around those for whom the vaccine is not yet available and for those with health conditions that make them uniquely vulnerable. This is why we can all do our part now by being vaccinated if we haven't already, and reducing the spread of COVID-19 by limiting our contact with those outside our household as much as possible. These measures work, but it takes all of us making safe choices every day to do our part. Thank you, and we're happy to take questions.
Right, thank you, Dr. Hinshaw. We're now going to move over to our media Q&A. There are a lot of people both on the line and here in person, so I'd ask you to please limit yourself to one question, one follow-up. As well, for journalists gathered here today, please state your name and the news outlet you're with, as well as who your question is directed to. And we are going to start with the phones before jumping back to finish in the room here. And operator, can you please put through our first caller?
Keller, Globe and Mail.
Hi, Premier. Did you ask for Tyler Shandro's resignation? And if so, what about his performance would lead you to do that?
Thank you. So Minister Shandro offered his resignation, and he and I both came to the same conclusion that the time was right for a new set of eyes and a fresh start at the Health Department at this time. Thank him for his service, and looking forward to his work at Labour and Immigration.
And James, do you have a follow-up?
A slightly different topic. I saw Minister McIver's tweets today about why the request for federal assistance went out today, that he was waiting to see who won the election and who the minister would be. But you would know that this really doesn't make a whole lot of sense. Regardless of the result, the minister doesn't change the day after the election. So why did that request not go out yesterday or last week when the state of emergency was declared? And did Minister McIver really not understand what happens to ministers during a transition, or is there another reason?
Well, there has been, as Minister Blair has confirmed, ongoing discussions between Alberta and federal officials to scope out areas of potential cooperation. As you know, until last night, the government was in caretaker mode, and last night the government was clarified so that we can deal directly with the elected ministers. We are not in a position now, and nor were we last week, where we have imminent need of federal assets. This is a contingency planning process in case we end up in a worst-case scenario. And if I could just add to that, yes, I am very familiar with the process as a former Minister of National Defence, and indeed our Deputy Minister of Health, Paul Winnick, is a former Vice Chief of Defence Staff and former Commander of the Canadian Army. I think there may be some misconceptions that I've seen in the debate here about the kind of relevant assets that, for example, the Canadian Armed Forces might be able to provide to our situation. To be clear, the Canadian Armed Forces now has only a very small and limited medical healthcare capacity. 25 years ago, they essentially wound down their hospital system, and almost all of the care provided to members of the Canadian Armed Forces are provided by provincial health systems or by private contractors. So they have very, very limited capacity in the areas that where we are shortest, which would be, for example, registered nurses with ICU experience. In the case of Ontario and Quebec, for example, where the forces did play a very helpful role, it was primarily the deployment of reservists to nursing homes to perform very basic healthcare aid functions. That is not. Those are not the needs that we have. One asset they have which could be helpful in a worst-case scenario would be to assist with the transportation of patients out of province. So again, this is largely a formal part of the planning process. We are not now in need of those assets, but it's responsible for us to plan for a worst-case scenario.
Thank you. Operator, can you please put through our next caller?
Next question is from Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question. I'm still not entirely clear about why Tyler Shandro has been shuffled out of the Health Ministry and new Minister Jason Kenney is in. There are a lot of questions, I think, being begged here. So why now? What precipitated this move today?
Well, again, Minister Shandro offered his resignation. He and I both came to the conclusion that it would be best to get a fresh pair of eyes and a fresh start at the health ministry. It has been a grueling 2+ years. For Tyler, I was there myself and saw he and his family being chased and assaulted by anti-vaccine protesters, and all of that I know has taken a real toll on Minister Shandro. And he's done his very best in the position, but he and I both came to the conclusion that we best to have a fresh start, and Minister Copping has really, I think, proven himself as a very thoughtful and capable minister, and I look forward to renewed direction of the health ministry under his leadership.
And do you have a follow-up, Lisa?
Thanks. Yeah, I wish the best to Minister Copping, but it's still not clear to me why this is a here and now decision to make. So I have to ask you to address some of the rumors that we've heard. Is this move being made to appease a contingent of the UCP that is angry with your leadership right now? Does this have anything to do with what's going on in the party right now?
We are focused on one thing, which is getting through this fourth wave and preparing for whatever else COVID may have in store for us in the future, not on politics. And again, Tyler came to me, offered his resignation, felt that under these circumstances it was an optimal time for a fresh approach, a fresh set of eyes on the department. And I accepted that, and I look forward to working with Minister Copping in that position.
Thank you. Operator, can you please put through our next call?
Next question, Carrie Tate, Globe and Mail.
Hi, my question's for the Premier. Where did you vacation this summer? I understand, like, you have room for your privacy. I'm not asking what hotel you stayed at. I'm asking what countries you went to.
What I do with my private time is private. I took a couple of weeks of private time. I was in touch with my office every day and was in touch with senior officials. I had regular briefings and made decisions that we announced. For example, the rollout of the first round of booster shots. And we did the planning on the $100 incentive, all of that while I was on personal time. As I pointed out, I think since I entered provincial politics, well, really before that, since 2015, I had this was my second time of more than a few days away. So, maintain contact with my office and officials throughout.
Thanks, Carrie. Do you have a follow-up?
Yes, the minister had spoke about priorities of expanding healthcare. Does that include private options?
Well, as you know, the answer is yes. As you know, we ran on a platform to launch the the strategic surgical initiative to replicate a successful program in Saskatchewan, where the government significantly increased the number of surgical procedures that it contracts out to what we call chartered surgical facilities, privately owned and operated facilities. As you know, private delivery is a major part of the publicly insured universal healthcare system in Canada. It always has been. Even under our predecessors, the NDP, who have a certain ideological hostility to private delivery, they contracted out thousands of surgeries to privately operated facilities. Every doctor's office that you go into is a private business, and almost all of the doctors in our network are private contractors, are professionals that provide services as limited partnerships, as businesses. So private delivery within our universal publicly insured system has always been the Canadian system, and we are exploring every way we can now to increase capacity. You know, we've made some announcements, requests for proposals on the surgical initiative. We are moving forward. And we think that this can really help us, actually, once we get through this wave, to catch up on the postponed surgeries. I think it would be bloody-minded for us to say that we will only do that in government hospitals when we have tremendous assets available through privately operated chartered surgical facilities. So the answer is yes, but of course, this will be done within the context of public insurance.
Okay, operator, can you please put through our next caller?
Rick Bell, Calgary Sun.
Good afternoon, Premier. You've heard and seen, I am sure, various news reports about a caucus meeting tomorrow and people talking about perhaps pushing for a very early leadership review, perhaps pushing for a vote of non-confidence in your leadership, perhaps asking you to resign your position as Premier. How do you react to those stories, and do you treat this as any kind of sort of threat to your leadership, or how do you feel about it when you hear these various stories, not just about unrest, but about people actually saying that they're planning to do something as early as tomorrow morning?
Well, Rick, I'll just say that those kinds of reports are not new. You've written a lot of columns about similar rumors and innuendo. As I've said before, and as you know very well, it's no secret that there are a lot of supporters of my party who don't like public health restrictions. And there are others who don't like our very focused efforts to increase vaccination. And so that has been something with which we've been grappling from the very beginning of the pandemic. There's no point in sugarcoating it. We saw this in yesterday's federal election, Rick, where in this province, I think 8% of voters cast a ballot for a party that I think was largely a statement against public health restrictions and the vaccine program. So it is a minority, but a significant number of people, nevertheless, who are very angry about these policies that we believe are necessary to save lives. I've said this to you before. My ultimate responsibility in this context is to protect the healthcare system, to avoid large-scale preventable deaths, regardless of the political consequences. It requires leadership. Not everybody agrees with this direction and approach, but it is the approach supported by Alberta's cabinet on the public health advice that we receive, and it will continue to characterize Alberta's approach. We will not allow politics or political pressure to distract us from this essential goal.
Okay, Rick, do you have a follow-up?
Yes, just a quick one. Thanks for the answer, Premier. The follow-up is, do you consider that there is or is not a serious threat to your leadership? In other words, do you believe that your job as Premier is actually on the line because of the reports that I have written and others have written? Do you think that your job is in any sense in jeopardy, or are you staying in the job and just continuing on?
Well, when you're in an elected office, in one sense, your job is always conditional. And that's a democracy. It's always conditional on the consent of the governed. We received a mandate of over 1 million votes in the last provincial election. And that's the mandate that we're governing with. There are internal mechanisms for accountability in my party. For example, there will be a leadership review. Our party board is sorting out when exactly that will be. There are a lot of people with different opinions on it, but there will be a leadership review, and I'm happy to be held accountable to the members of my party. But at the end of the day, Rick, we can't allow the government during a period of crisis like this to be distracted or destabilized by political opposition to policies that are absolutely necessary to protect the healthcare system and to save lives. So I have a higher obligation, much more important than me being in this job or anything political, and that is the obligation on which we are acting.
Okay, we'll take our last call before jumping here to the floor. Operator, can you please put through our last caller?
Our last question comes from Andrew Lawton, True North.
Good evening, Premier. Curious about what the federal election means for Albertans. We have a growing problem of Western alienation. A lot of people that were on the fence between simply voting yes on the referendum and pushing for a more aggressive independence or separation measure have often said that if Justin Trudeau gets reelected, that's it. Curious what this means for your plans moving forward with the referendum and trying to keep the peace.
Well, I would note, Andrew, that the de facto Western Separatist Party, the Maverick Party, got only about 1% of the vote in Alberta last night, and they couldn't even field a full slate of candidates. I think that's probably understates support for separation in this province significantly, but it is a signal that I believe the vast majority of Albertans are frustrated with how the country works. What frustrates them most is the expectation from Ottawa that we generate so much wealth, so much tax revenue, so many jobs, and yet are hampered by policy after policy clobbering our biggest industry. And so that's the heart of the frustration. As you know, it has a long history. And yet, despite that frustration, I believe that the vast majority of Albertans are also proud Canadians. The majority of Albertans went out and voted in a federal election yesterday. And as I say, 1% voted for a separatist party. I think, that's my, I'll listen to your follow-up.
Okay, go ahead.
My follow-up dovetails on Rick's questions for earlier. You've talked about your party having a mechanism that it's sorting out for a leadership review. You've heard the frustrations from your members and your voters. Why are you not being more proactive in initiating that and actually inviting that review? If you're proud of the way you've been handling these things, why not make a point of going after your own party and saying, okay, do I have a mandate to stay on?
Sure. I've invited a review. There's a review that will take place. But, Andrew, right now, 100% of my attention, that of my team, and the whole government has to be focused on a life and death crisis that we are facing. To open this up for some big political argument at this moment would, I think, be grossly irresponsible. We need, our entire team needs to be focused on one thing and one thing only right now, which is beating this fourth wave of COVID and ensuring we're prepared for whatever may come in the COVID era. It is literally a question of life and death. So for me to sort of improvise a internal party process and dispute would, I think, be regarded by the vast majority of Albertans as a kind of self-indulgent political sideshow, as opposed to doing the job that any government of any partisan stripe must do now.
Okay, we'll now jump to the floor. Go ahead, Michelle.
Hi, I'm Michelle Belfontaine from CBC. Premier, the calls for you to resign are getting louder, and we know there is a caucus meeting tomorrow where much will probably happen. How much longer do you think you can hang on as Premier without the confidence of your MLAs, the grassroots, and the leadership and the executive of your party?
Well, I completely reject the premise of your question, and I can tell you that I believe I have the confidence of the members of my party, of our caucus, of our party board. There will be a leadership review in due course. We cannot allow politics, including internal politics, to distract us from the essential task of doing the right things. Now, particularly when throughout the past 18 months, most of the internal political opposition to which you refer has been focused around opposition to necessary public health measures. I knew full well, as did my cabinet colleagues last week, that when we adopted, for example, the restriction exemption program, the proof of vaccination program, that there were some members of government caucus who would not be happy, that there would be members of my party who would not be happy, and yet it was the right thing to do. And so we'll continue to do what is necessary to address the challenge of this lethal wave. And I, for one, will not be distracted by politics in that process.
Do you have a follow-up, Michelle?
Yes, Premier, you may reject the premise of my question, but this is what we're hearing from people, from your own MLAs. And, you say it's people who are opposed to the public health measures, but it's also people who don't think you did enough. So again, I'm going to ask you the same question. How do you hang on as the leader of your party and as Premier? I mean, how much longer do you think you can hang on?
Michelle, I led a party to the largest total vote in Alberta electoral history just over 2 years ago. We have had tensions internally over how best to respond to COVID. We've had some people, yes, who said who have advocated for for earlier and harder restrictions. Most who've argued against restrictions. Many who are unhappy with the restriction exemption program that we announced last week. But I can tell you this, in terms of our caucus, we have by far the most extensive and respectful engagement of any government caucus in Canada when it comes to COVID response. In the last 3 weeks, I think we've had approximately 12 hours of caucus meetings with exhaustive presentation of information where everybody gets to speak their mind, often more than once, and where ministers of the COVID Cabinet Committee take seriously the input that we receive. Often that input is, there's not a consensus, but we desperately want to hear from the elected representatives of Albertans. You know that we have also, in this government, provided the greatest latitude of any government in Canada for members to speak their minds even when they don't conform to government policy. And so it's been difficult, there's no doubt about it. People feel strongly and passionately about these issues. There is a very stark range of opinions across the province that are reflected in my party and in our caucus. It's no secret. But at the end of the day, the government has a responsibility to make tough decisions. And in this life and death context, to make tough decisions, frankly, regardless of the political consequences.
Bonjour, Andréane Williams, Radio-Canada. My questions have been asked in English, so I'll just ask them in French, if that's okay with you.
Okay.
Est-ce que vous pourriez expliquer le contexte entourant la démission de Tyler Shandro et en quoi cette démission-là va permettre de mieux faire face à la crise et d'alléger la pression sur nos hôpitaux?
Le ministre Shandro, excuse-moi, le ministre Shandro m'a offert sa démission de poste de ministre de Santé. J'ai accepté sa démission parce que nous étions du même esprit que ça serait un bon moment d'avoir un renouvellement de leadership au ministère de Santé et d'avoir un nouveau regard avec un nouveau ministre. Alors, j'ai accepté sa démission. Je remercie le ministre Shandro de son travail acharné. Il a duré énormément de pression, y compris sa famille, depuis plus de 2 ans, dans une situation extrêmement difficile. Et j'ai hâte de travailler avec lui en tant que ministre de Travail et Immigration et avec le ministre Coppin dans ses nouvelles responsabilités comme ministre de Santé.
Any follow-up?
Oui. Qu'est-ce que vous répondez aux critiques au sein même de votre parti qui vous accusent de ne pas avoir agi assez rapidement pour faire face à la 4e vague?
Well, alors, je dirais que la grande majorité des critiques à l'intérieur de mon parti s'opposent aux mesures de santé publique et de notre programme de vaccination. Alors, nous savons tous qu'il y a une grande diversité des opinions en Alberta qui sont reflétées dans mon parti en ce qui concerne la meilleure façon à nous protéger, à répondre aux défis de COVID-19. Nous entendons toutes les opinions, y compris celles des députés élus, mais en bout de ligne, c'est la responsabilité grave du gouvernement et de moi comme Premier ministre de prendre les décisions nécessaires pour protéger les vies. Et nous allons continuer de prendre ces décisions nécessaires, néanmoins les conséquences politiques.
Okay, we have time for about 2 more questions. Go ahead.
It's Jeremy Thompson with CTV. Premier, another question for you about the cabinet shuffle. Wondering, again, sort of why now, as far as both Minister Copping and Minister Shandro having to learn new portfolios, and obviously Minister Copping is in the room, so if he wants to supplement, just sort of, isn't that sort of a bad time for that, given where we are in this pandemic right now, having to learn, and maybe just sort of what sort of qualifications or experience does Minister Copping have in the health area that helps him in this role?
Thank you. Good questions. So there's never an optimal time to make a change like this, but and you're right. When there's a change of ministers, there's a transition period. I do know this. Minister Copping is a very quick study. He's proven himself both in his private sector life and in his ministerial responsibilities to be as I say, a very quick study with very sound judgment, who I think will focus immediately on the essential issues. And the minister is not the department. The minister works with a huge team, a very capable senior team that will be there to support him starting this afternoon. So again, there's no perfect time ever to make a change, but both Tyler and I came to the conclusion that it was the right time to have a fresh set of eyes and to have a fresh start there at the Health Ministry.
Do you have a follow-up, Jeremy?
I do. I believe it's actually for Dr. Hinshaw or perhaps Minister Copping. I'm just wondering, as we see the COVID case numbers rise, obviously there's more COVID cases among children as well. And just sort of wondering, how concerning is that for you, and what if any, steps are you able to take to fight off more cases among children?
Thanks for the question. Certainly more cases in any age group is concerning, and we are watching closely the numbers in all of our age groups. We know that kids under 12, again, don't have access to the protection that vaccines offer, which is exactly why we are doing everything we can to support those who are turning 12 this year and older to be able to access the protection that vaccines offer. We have not seen to date a different kind of experience with respect to kids and severe outcomes than we've seen in previous waves. However, if we have more cases, then even with the same percent of kids to have severe outcomes, we will see an increase in the number of kids who end up needing hospital care. So I want to reiterate again that the most critical thing that all of us can do is to make sure that we're following those public health measures, that any of us who have symptoms, even if mild, stay home and away from others, and that everyone who's either turning 12 this year or older take advantage of the protection that vaccines offer, not just for themselves, but for others as well.
Okay, all right, we'll now get ready for our last question of the night.
This question's for the Premier.
Go ahead.
Premier, Kieran Levitt here with the Toronto Star. Thanks for taking my questions. You said that internal criticism within your own party is around sensible public health measures that were necessary to bring in, but up until very recently, you yourself were against those same public health measures. How do you reconcile that? And how do you explain that what you're doing today is not political?
So how do I explain? On the first question, I know that, as I said last week, pretty much everyone, what they really crave in COVID is some kind of sense of predictability. They want to know where are we going. They want consistency in policy, because we're also exhausted with the constant changes to our life. I get that. But the reality is this: the disease is not predictable. And so the only way to have a consistent policy is either to take the approach of some of the southern U.S. states and just let her rip, regardless of the death rate, or to take the position of some other jurisdictions and have a kind of perennial hard lockdown. Neither of those has been the Alberta approach. Our approach has been to use restrictions as a last and limited resort to protect the capacity of the healthcare system. So that means that we've had to change policy to address the circumstances. I've always, that has been the approach of this government from day one. I think that for some people who are deeply opposed to restrictions, I hear them. I think they make some very good points, that there are restrictions bring their own damage, that there are other health challenges, the mental health challenge, the opioid addiction challenge, and so much more. So that is an important perspective in the debate. But at the same time, it would be grossly irresponsible to allow a wave like this to go to overwhelm our hospitals. So what the government has sought to do is take a balanced approach. We have not done so perfectly. I will once again point out that we have, as a province, had a lower per capita fatality rate than Canada, substantially lower than the United States and the European Union. And we've broadly done that with less damaging health restrictions. It's not a perfect response, but in the global context, I think Albertans have done quite well in rising to the challenge. Now, again, there are people that disagree with that. And yes, you saw last night, 9 or 8% of Alberta voters, I think, pretty clearly expressed that. And let me be blunt. I'm sure a lot of those people voted for me and my party in the last election. And last night, they got a chance to speak out against vaccines, against public health measures. But that is it's an intensely held view. People have a right to their view, but the government has a responsibility to take the necessary actions.
Do you have a follow-up, Kieran?
Yeah. Back on the political question, using the logic that you applied here today about needing a change in the health portfolio to move forward, I think it's fair to say that people within your own party, including Joel Mullen, who posted an op-ed today specifically calling on your resignation, also want a new direction in your office and in your position. You did that with former Health Minister Shandro. Why not do that yourself?
Again, there have been voices of opposition to public health policies from within my own party from day one of the pandemic. It's not a secret, but my responsibility as Premier is to listen to public health advice, look at the reality, not wish it away, not allow politics to pressure us from taking the necessary steps to save lives and protect the healthcare system. And I've always known from day one that has created some internal division. It's no secret within my party. As I just said, tens of thousands of Albertans last night voted for a anti-vaccine, anti-public health policy party, and some of those people are not happy with the public health policies of government. I get it. I would say to them, in terms of leadership and internal politics, let's deal with those things at the right time when we're past the crisis, not in the middle of the crisis, when whoever is in my chair has to stay focused on the big decisions.
Okay, thanks, folks. That concludes today's media availability.
Thank you very much.